Good afternoon, folks. This afternoon's topic C is title is 5 Ways COVID-19 Forever Changed How Americans Plan for Long-Term Care. So we're gonna explore that for C. So please join me for the little presentation I made. Okay, here we go. The article 5 Ways COVID-19 Forever Changed How Americans Plan for Long-Term Care explores how the pandemic shaped uh, perspectives on aging and care. Here are some key points. Okay, in number one, increased preferences for aging at home. Many people now prefer home-based care instead of nursing homes, given the challenges seen during COVID-19. Okay. 2, greater focus on future medical planning. Individuals are being more proactive about organizing end-of-life care and medical directives. 3, rise in home care demand. There's been a surge in home care and home health care services as families seek alternatives to nursing homes, to institutional care, guys. Give me 1 second, please. Four, planning adjustments, financial planning adjustments. The pandemic highlighted the importance of financial preparedness for long-term care. 5, technology's expanding role. Telemedicine and digital health tools have become essential in long-term care strategies. The pandemic prompted a shift toward more independent, personalized, and well-planned care approaches, ensuring better support for aging individuals. Let me know if you want further details. The demand for home care services has surged, particularly since the COVID-19 pandemic. Here's why. Number one, aging population. More seniors prefer to age at home rather than move to facility, folks. Into assisted living facilities, driving up the need for home-based care. 2, pandemic impact. COVID-19 exposed vulnerabilities in nursing homes, leading families to seek safer, more personalized care options. 3, financial considerations. Home care is often more affordable than institutional care, making it a practical choice for many households. 4, workforce challenges. While demand has increased, home care agencies face staffing shortages, making it harder to meet growing needs. 5, technical advancements. Telemedicine and smart homes. Telemedicine and smart home devices have made home care more accessible and efficient. Okay. Next page, folks. The shift reflects a broader trend toward independent, personalized, and cost-effective care solutions. Let me know if you'd like more details on any of these points. The aging population in the U.S. is growing rapidly, leading to increased demand for home care services. Here are some key statistics. Okay, guys, I'm going to go through these for you. Population growth. The number of Americans aged 65 and older is projected to reach 83.9 million by 2050, nearly doubling from 43.1 million in 2012. Okay, home care revenue increase. The home healthcare industry saw a 50.5 revenue increase from 2013 to 2020, reflecting the rising demand for in-home services. Okay. Next page. Preferences of aging at home. Around 90% of seniors prefer to age in place rather than move into institutional settings. Home care market size. The U.S. home health care market valued at $107 billion in 2025 and is expected to grow significantly in the coming years. Caregiver shortages. Over 59% of home care agencies report ongoing caregiver shortages, making it challenging to meet the growing demand. These trends highlight increasing reliance on home care services as seniors seek more independent and personalized care options. Let me know if you'd like more details on any of these points. The demographics of the aging population in home care reflect a hold on. I get growing need for personalized and accessible care solutions. Here are some key insights. Population growth. The number of Americans aged 65 and older has reached 55.8 million, highlighting the increasing demand for senior care. Gender distribution. Women making up a large portion of the aging population as they tend to live longer than men. Ethnic diversity. The senior population is becoming more diverse with increasing numbers of Hispanic, Black, and Asian older adults requiring health home care services. Geographic trends. States like California, Texas, and Florida have the highest concentration of seniors. Let's see. Driving strong demands or demand for healthcare. Okay. Economic factors. Many seniors rely on Medicare and Medicaid or private insurance to cover home care costs, but affordability remains a concern. Caregiver shortages. Over 59% of home care agencies report ongoing caregiver shortages, making it challenging to meet the growing demand. These trends highlight the evolving landscape of home care, emphasizing the need for accessible, culturally compliant, and financially sustainable care solutions. Let me know if you'd like more details on any of these points. The future projections for ongoing population demographics indicate significant shifts in the upcoming decades, guys. Give me 1 second, please. Give me 1 second. Be right with you. Population growth. The number of Americans aged 65 and older is expected to rise from 58 million in 2022 to 82 million by 2050, increasing their share of the total population from 17% to 23%. Racial and ethnic diversity. The older population is becoming more diverse by 2050. The share of seniors identifying as non-Hispanic white is projected to drop from 75% to 60%. Working age population decline. The percentage of U.S. population that is for of working age 15 to 64 expected to decline across most racial and ethnic groups, with immigration playing a key role in mitigating the impact. Median age increase. The median age of the U.S. population has already risen, folks. That means more seniors to take up more care for nursing homes and for private agencies to come to them for attendant care. It's a serious crisis, folks. From 30.0 in 1980 to 38.9 in 2022, and it is expected to continue increasing. Economic and social implications. A growing senior population will impact healthcare systems, Social Security programs and caregiving needs, requiring adjustments in policies and infrastructure. These trends highlight the need for long-term planning in healthcare, workforce and development, and social support systems to accommodate aging population. Let me know if you'd like more details. The aging population presents a significant challenges and opportunities for healthcare systems worldwide. Here are some implications. 1. Increased demand for healthcare services. As people live longer, there is higher demand for primary care, specialty care. Give me 1 second, folks. Long-term care and supportive services. 2. The burden of age-related diseases. Chronic conditions such as cardiovascular disease, cancer, dementia, and osteoarthritis become more prevalent, requiring specialized care. 3. Complexity of care needs. Older adults often have multiple chronic conditions, functional impairments, and cognitive decline, increase in necessitating coordinated and multidisciplinary care. 4. Healthcare workforce challenges. The growing senior population places strain on physicians, nurses, and caregivers, requiring investment in, hold on, I get more. Investment in geriatric training and workforce development. 5. Rising healthcare costs. Providing care for older adults is costly, leading to financial pressures on healthcare systems, insurers, and governments. 6. Long-term care needs. More seniors require assisted living, nursing homes, and home-based care, prompting the need for innovative care models. Okay, 7. Global demographic shift. By 2050, 80% of older people will be living in low and middle income countries, requiring adaptations in healthcare infrastructures. Okay, these trends highlight the need for sustainable healthcare policies, integrated care models, and investment in preventative healthcare strategies to support aging populations. Let me know if you'd like more details, folks. Now, like I said, this is a healthcare crisis for seniors, many of whom are seeking more care based at home, meaning that they want people to come in to care for them. They don't want to go out and seek care. They don't want to go out of their homes. They want to age in place, folks. They don't want to spend time in facilities. Putting somebody in a facility takes more money. It's more cost effective to find a agency that comes into them more. It's more feasible for people to age in place at home with the right supports. Gives them more dignity. If you put a person in a nursing home, person is just a to staff that run the nursing home. It's just a person. They're just a resident taking up space. Okay. Nursing home care, you get like one person gets 40 people to take care of during the day, folks. The one-on-one goes away. When you put somebody in a nursing home, the one-on-one attention that you get goes away. But with the right supports, senior person can live at home, with the right supports. Now meaning that you find an agency, or if you're able to do direct home care, which is a lot easier. You hire and fire your own folks when it comes to direct care, guys. Agencies find them for you, send them in to you, and then you do interviews to see if they fit your lifestyle and needs. But most of the agencies hire right off the street. You have to find the right person, guys. You have to be able to train them. A client has to be able to train them what they need personally, on their own needs. Meaning the client has to train them as to what they want for care. In-home care is the best option for elderly folks, as far as I'm concerned. Now, I've seen both sides, guys. The nursing home is not all cracked up to be perfect. Like I said, an aide gets 40 people to take care of, and she has so much time to finish her duties. Now, meaning that she may take 5 minutes with one person, 10 minutes with another person, 20 minutes with another person. But listen, she has 40 people to take care of in a facility. That's not personal anymore. That's like my analogy for that is like an assembly line. Like cars, almost. Car parts and assembly line. That's like being in a facility. You don't always get care right away. You have to wait. You may buzz for a nurse's aide. Like I said, she has more than one person to take care of. So you have to make sure that you're willing to wait for care for folks. And the other side of that is that after your insurance runs out in the facility, like I said earlier in another video, they start charging for little details, like for toilet paper, for washcloths and toilet paper, guys. So most seniors are choosing to do in-home care for the better option. So I thought I'd do a show on that tonight. But it is a senior crisis, folks, because there's more seniors coming to need care than there is people. So there has to be more allowances for senior care. You have to come up with newer ideas to attract more people to want the jobs. People have to want to be in the profession. Some people um some people look at home health care as an easy way to make money, but it's not always about money, guys. You have to care about the people that you serve. First of all, you have to see a person as a person, and not just a resident, or not just a client. You have to see them as people, because elderly folks deserve better care. That's my point of view. So, with that being said, I might jump back on later for shows, but for now, Gator Wellness, take care, folks.